What if a life-saving vaccine also created one of the biggest trust crises in modern healthcare? The story of the polio vaccine is not just about disease prevention, it's about fear, misinformation, mistakes, and the lasting damage to public trust. Vaccines have saved millions of lives, yet the polio vaccine remains one of the most controversial medical stories in history. In this video, a healthcare professional breaks down how and why trust in healthcare was damaged, especially in vulnerable communities. This is not an anti-vaccine video. Instead, it's an honest look at the events, errors, rumors, and communication failures that shaped public fear and skepticism, many of which still affect vaccination campaigns today. In this long-form video, you'll learn how the polio vaccine was developed and why it was revolutionary, what went wrong during early vaccination campaigns, how misinformation and political factors fueled fear, why some communities lost trust in doctors and healthcare systems, the long-term impact on public health and disease prevention, what lessons modern healthcare must learn to rebuild trust. When trust breaks down, even the best medical solutions can fail. This video explains how poor communication, lack of transparency, and historical mistakes continue to influence how people view vaccines today. Understanding this history is essential not to spread fear, but to build better healthcare systems, honest dialogue, and informed decisions. The story of the polio vaccine is often told as one of medicine's greatest victories, but for many communities around the world, it also represents a deep and lasting loss of trust in healthcare systems. Polio was once one of the most feared diseases on Earth, paralyzing children and killing thousands every year. When vaccines were introduced, they offered hope, relief, and the promise of a future free from this devastating illness. Yet alongside this medical success, a complex chain of events unfolded that would damage public confidence, governments, and global health organizations for decades to come. In the early days of polio vaccination, speed mattered more than communication. Governments and health authorities rushed to stop outbreaks, often failing to explain clearly what the vaccine was, how it worked, and what risks were involved. In some cases, mistakes were made during manufacturing and distribution, leading to serious side effects and even deaths. These incidents were rare, but they were powerful. For families affected by these tragedies, trust was shattered instantly. Word spread quickly, especially in communities where healthcare systems were already viewed with suspicion. As vaccination campaigns expanded globally, especially into poor and rural regions, historical and political factors further complicated the situation. In many countries, healthcare had long been associated with colonial control, government neglect, or forced interventions. When polio vaccination teams arrived without community involvement or transparent dialogue, people questioned their intentions. Rumors filled the gaps left by poor communication. Some believed the vaccine was unsafe, others thought it was a tool for population control, and many feared hidden agendas that had nothing to do with health. Misinformation played a major role in turning fear into resistance. In the absence of trusted local voices, false stories spread faster than scientific facts. Isolated medical errors were exaggerated. Coincidences were interpreted as proof of harm. In some regions, religious and political leaders amplified doubts, either out of genuine concern or personal interest. Once fear took root, it became self-sustaining. Every illness after vaccination was blamed on the vaccine, while the countless lives saved went unnoticed. The damage to trust did not remain limited to polio alone. Skepticism toward one vaccine slowly expanded into doubt about the entire healthcare system. Doctors were no longer seen solely as healers, but as representatives of distant institutions that did not listen. Hospitals became places of fear rather than safety. Preventable diseases returned in areas where vaccination rates dropped, reinforcing cycles of illness and mistrust. Ironically, the very effort designed to protect communities sometimes deepened their vulnerability. Another critical factor was the lack of accountability and empathy when things went wrong. In many cases, affected families were not acknowledged, compensated, or even heard. Silence from authorities felt like denial. When people experience harm and see no responsibility taken, trust collapses completely. Healthcare is built not only on science but on human relationships, and those relationships were often neglected in the push to eradicate polio as quickly as possible. Over time, global health organizations learned painful lessons. Successful vaccination campaigns eventually began involving local leaders, educators, and healthcare workers who understood cultural concerns. Open conversations replaced one-way instructions, transparency improved, and efforts were made to admit past mistakes rather than hide them. Slowly, trust began to return in some places, but scars remain. Even today, resistance to vaccines can often be traced back to historical experiences linked to polio campaigns. This story is not about blaming vaccines or denying their life-saving impact. The polio vaccine has prevented millions of cases of paralysis and brought the world to the brink of eradicating a disease that once terrified entire generations. The real lesson lies elsewhere. Science alone is not enough. Without honesty, respect, and trust, even the most effective medical intervention can fail. Understanding how trust was broken helps explain why healthcare misinformation spreads so easily today. Fear does not come from ignorance alone, it comes from memory. Communities remember when they felt ignored, deceived, or harmed. Rebuilding trust requires acknowledging those memories and addressing them with humility. It requires healthcare systems to listen as much as they speak and to treat people as partners rather than targets of intervention. The legacy of the polio vaccine is therefore both a triumph and a warning. It shows what medicine can achieve at its best and what happens when communication, transparency, and empathy are missing. As modern healthcare faces new challenges from pandemics to emerging diseases, these lessons are more important than ever. Trust is fragile, hard to earn, and easy to lose. Protecting it may be just as important as developing the next life-saving cure. If we want a healthier future, we must remember that healthcare does not begin with a needle or a pill. It begins with trust. The polio vaccine is remembered by many as a miracle of modern medicine, a breakthrough that saved millions of children from paralysis and death. Yet for others, the same vaccine became a symbol of fear, doubt, and broken trust in healthcare systems. This contradiction did not happen overnight. It was shaped by historical mistakes, poor communication, political influence, and a failure to understand the human side of public health. To understand why trust was damaged, it is necessary to look beyond science and examine how people experienced these vaccination campaigns in real life. When polio outbreaks were at their peak, panic drove decisions. Governments and health authorities acted quickly, often believing that urgency justified silence. Vaccines were delivered with instructions but little explanation. For many families, especially in underdeveloped regions, this sudden medical intervention felt forced rather than helpful. People were told what to do, not why it mattered. In communities where healthcare access had always been limited, this approach raised suspicion instead of confidence. Early vaccination programs were not perfect. Manufacturing errors, contamination incidents, and unexpected side effects occurred, even if rarely. When these incidents happened, transparency was often missing. Authorities downplayed risks to avoid panic, but this strategy backfired. When families saw children harmed and received no clear answers, rumors replaced facts. Silence created space for fear, and fear spread faster than truth. Historical context made things worse. In many parts of the world, medical systems were tied to colonial rule, political control, or military power. Healthcare workers were not always seen as neutral helpers, but as representatives of outside authority. When polio vaccination teams arrived without community involvement, it triggered memories of past exploitation. Even a life-saving intervention can be rejected when it feels imposed rather than offered. Misinformation did not appear randomly. It grew where trust was already weak. Stories circulated that the vaccine caused infertility, carried hidden diseases, or was part of foreign experiments. Scientific explanations failed to compete with emotional narratives shared by neighbors, elders, and local leaders. Once belief systems formed around these fears, logic alone could not undo them. Every negative outcome, whether related or not, was blamed on the vaccine, reinforcing resistance. Healthcare workers themselves often became victims of this mistrust. Doctors and nurses trying to help were attacked, rejected, or ignored. This further widened the gap between communities and medical institutions. When communication breaks down, both sides suffer. Patients avoid care, and healthcare providers lose the ability to protect public health effectively. The issue was never just the vaccine, it was the absence of empathy. Many families felt their concerns were dismissed as ignorance. Instead of listening, authorities focused on coverage numbers and deadlines. But trust cannot be measured in statistics. It is built through respect, dialogue, and accountability. When mistakes happen, apologies were rare. Compensation was limited. Healing, both physical and emotional, was incomplete. Over time, the consequences became visible. Vaccination refusal led to new outbreaks. Preventable diseases returned. Ironically, fear of harm caused greater harm. Children suffered not because vaccines were ineffective, but because trust had collapsed. This cycle reinforced negative beliefs, making future health interventions even harder to implement. Global health organizations eventually began to change their approach. Community engagement became a priority. Religious leaders, teachers, and local health workers were included in conversations. Campaigns shifted from commands to collaboration. These efforts helped rebuild trust in some areas, but the damage was already deeply rooted. Even today, resistance to vaccines often echoes the same concerns first raised during polio campaigns decades ago. This history offers an important lesson for modern healthcare. Science cannot succeed without trust. Data does not replace dignity. Education must be two-way. People need to feel heard, respected, and safe before they accept medical advice. Fear is not always irrational. It is often based on lived experience. The polio vaccine ultimately saved the world from one of its most terrifying diseases. That achievement should never be denied, but neither should the failures that accompanied it. Ignoring those failures risks repeating them. Trust is fragile, especially when lives are at stake. Once broken, it takes generations to restore. Today, as healthcare systems face new challenges from global pandemics to emerging technologies, the story of the polio vaccine remains deeply relevant. It reminds us that progress is not only about cures and prevention, it is about relationships, it is about honesty in moments of uncertainty. It is about acknowledging harm when it happens and committing to do better. Healthcare begins long before treatment. It begins with trust. Without it, even the most powerful medicine can fail. The polio vaccine is widely recognized as one of the most important medical achievements of the 20th century. It played a major role in protecting millions of children from paralysis and death and brought the world closer to eliminating a disease that once terrified families across continents. Yet, despite its undeniable success, the history of the polio vaccine also reveals a painful and often overlooked reality. In many places, it became linked to fear, suspicion, and a deep loss of trust in healthcare systems. This loss of trust did not happen because people rejected science itself, but because of how science was delivered, communicated, and enforced during some of the most intense public health campaigns in history. During the height of polio outbreaks, urgency shaped nearly every decision. Governments and health authorities were under enormous pressure to act fast, hospitals were overwhelmed, parents were desperate, and communities were living in constant fear of a disease that could paralyze a healthy child overnight. In this environment, speed was prioritized over communication. Vaccination programs were launched rapidly, often without sufficient explanation to the public. People were told that the vaccine was necessary, but not always told how it worked, what risks existed, or what to expect after receiving it. For many families, especially those with limited access to education or healthcare, this lack of information created anxiety instead of reassurance. Early vaccine development and distribution were not without flaws. In rare but significant cases, production errors and contamination incidents occurred, leading to serious harm. These events affected a small number of people compared to the millions protected, but their impact on public perception was enormous. For families who experienced loss or injury, statistics offered no comfort. What mattered was their personal reality, and when they sought answers, they often encountered silence or minimization. Authorities feared that openly discussing mistakes would fuel panic, but avoiding transparency only deepened suspicion. When people sense that information is being hidden, trust collapses quickly. Historical and political context further complicated matters. In many regions, particularly in parts of Africa and South Asia, healthcare systems were historically linked to colonial rule or centralized power structures. Medical interventions were not always associated with care and compassion, but with control and coercion. When polio vaccination campaigns entered these communities, they were sometimes viewed through the lens of past trauma. Foreign-funded programs, unfamiliar health workers, and aggressive timelines raised questions about motives. Even a life-saving vaccine can be rejected if people feel it is being imposed rather than offered. Misinformation flourished where trust was weak. Rumors spread that the polio vaccine caused infertility, altered genetics, or was designed to harm specific populations. These stories were rarely born out of ignorance alone. They were often rooted in fear, historical memory, and genuine concern for children's safety. In the absence of trusted communication, emotional narratives shared by neighbors and community leaders carried more weight than distant scientific explanations. Once fear became embedded in community belief systems, it proved extremely difficult to reverse. Healthcare workers found themselves caught in the middle. Doctors and nurses were trained to save lives, but many were unprepared for the social resistance they faced. In some areas, vaccination teams were met with hostility, threats, or violence. This created a tragic cycle. Fear led to resistance, resistance led to outbreaks, and outbreaks reinforced fear. Instead of strengthening healthcare systems, these conflicts weakened them, leaving communities more vulnerable to preventable diseases. One of the most damaging aspects of the polio vaccination story was the failure to acknowledge harm when it occurred. Public health campaigns often focused on success metrics such as coverage rates and case reduction, while individual suffering was treated as an unfortunate but acceptable cost. For affected families, this attitude felt dehumanizing. Trust in healthcare is not built solely on outcomes, it is built on empathy, accountability, and respect. When people feel unheard or dismissed, they disengage not only from a specific program, but from the entire healthcare system. Over time, the consequences of mistrust became visible. Vaccination rates dropped in certain regions, leading to the re-emergence of polio and other preventable diseases. Children suffered not because vaccines were ineffective, but because fear outweighed confidence. These outbreaks then became used as justification for more aggressive campaigns, which further damaged trust. It was a self-reinforcing cycle that proved incredibly difficult to break. Global health organizations eventually recognized that technical solutions alone were insufficient. Strategies began to shift toward community engagement. Local leaders, religious figures, teachers, and community health workers were included in planning and communication. Efforts were made to listen rather than instruct, to explain rather than command. In some areas, these changes led to meaningful improvements in trust and participation. However, rebuilding trust is slow work. Damage done over years or decades cannot be undone by a single campaign or message. The legacy of the polio vaccine extends far beyond polio itself. It shaped how communities perceive healthcare interventions, government health advice, and international medical organizations. In many ways, modern vaccine hesitancy is not a new phenomenon, but an echo of past experiences. When people express doubt today, it is often rooted in historical memory rather than present-day science. Understanding this context is essential for addressing fear without judgment. It is important to be clear that the polio vaccine saved countless lives and remains a cornerstone of public health success. Recognizing its role in eroding trust does not mean rejecting its value. Instead, it means acknowledging that good intentions and good science are not enough. How healthcare is delivered matters just as much as what is delivered. Trust cannot be demanded, it must be earned through honesty, transparency, and genuine partnership with communities. This story offers powerful lessons for the future of healthcare. Medical progress will continue to advance, bringing new vaccines, treatments, and technologies. But without trust, even the most effective innovations may fail to reach those who need them most. Public health must prioritize communication as much as cure, listening as much as instruction, and accountability as much as achievement. The history of the polio vaccine reminds us that healthcare is not just a scientific system, but a human one. It operates within society shaped by memory, emotion, and experience. When those human factors are ignored, harm can occur even in the pursuit of good. When they are respected, healthcare can become not only effective but also trusted. In the end, the true lesson of the polio vaccine is not about fear or failure, but about responsibility. It teaches us that saving lives requires more than medicine. It requires trust, and trust requires humility. If healthcare systems are willing to learn from the past, acknowledge mistakes, and commit to doing better, then the legacy of polio can still guide us toward a healthier and more united future. The story of the polio vaccine is often presented as a clear and unquestionable victory of modern medicine, and in many ways it truly is. Polio once terrified families around the world, striking children without warning and leaving lifelong paralysis or death in its wake. The introduction of effective vaccines dramatically reduced this suffering and brought humanity close to eliminating the disease entirely. Yet alongside this success exists another story, one that is quieter, the more uncomfortable, and deeply human. For many communities, the polio vaccine became associated not only with protection but also with fear, mistrust, and a lasting breakdown in confidence toward healthcare systems. This erosion of trust did not occur because people rejected science or wanted disease to spread. It happened because healthcare interventions were often delivered without adequate communication, cultural understanding, or transparency. During major polio outbreaks, urgency dominated decision-making. Governments and health authorities faced enormous pressure to act quickly, and speed frequently took precedence over dialogue. Vaccination campaigns were launched rapidly, sometimes with little effort to explain what the vaccine was, how it worked, or what side effects might occur. For families already struggling with limited access to healthcare and education, this sudden intervention felt confusing and, at times, threatening. In the early years of polio vaccination, the medical system itself was still evolving. Manufacturing standards, quality control, and monitoring systems were not as advanced as they are today. While serious adverse events were rare, they did occur, and when they did, the impact on public perception was profound. A single tragic case could outweigh thousands of silent successes in the minds of affected communities. For parents who believed their child was harmed, reassurances based on statistics felt distant and impersonal. When explanations were unclear or delayed, trust eroded even further. Transparency was one of the greatest casualties of this period. Health authorities often feared that openly discussing risks or mistakes would cause widespread panic and reduce participation in vaccination programs. As a result, information was sometimes withheld or simplified to the point of sounding dishonest. This approach backfired. People are remarkably sensitive to inconsistency, and when official messages conflicted with lived experiences, suspicion grew. Once people believe that information is being hidden, it becomes difficult to restore confidence, no matter how strong the scientific evidence may be. Historical and political factors also played a critical role. In many regions, especially those with histories of colonialism or authoritarian governance, healthcare systems were not seen as neutral or benevolent institutions. Medical programs were often associated with control, experimentation, or neglect. When polio vaccination campaigns arrived, sometimes funded or directed by foreign organizations, they were viewed through this historical lens. Even well-intentioned efforts could trigger memories of exploitation and loss of autonomy. In such contexts, resistance was not simply about the vaccine itself, but about power, identity, and self-determination. Misinformation thrived in these environments, but it did not arise in a vacuum. Rumors about infertility, hidden diseases, or secret agendas spread rapidly, filling the gaps left by poor communication. These narratives were compelling because they addressed emotional fears rather than scientific facts. People trusted voices they knew, family members, community elders, local leaders, over distant authorities who spoke in technical language and offered little opportunity for dialogue. Once these beliefs took hold, they were reinforced by every negative experience, whether related to the vaccine or not. Healthcare workers often found themselves on the front lines of this mistrust. Many were deeply committed to protecting children and communities, yet they faced hostility, rejection, and sometimes violence. This created emotional strain and further damaged relationships between providers and patients. When healthcare becomes associated with fear rather than care, people avoid hospitals, delay treatment, and disengage from preventive services. The consequences extend far beyond a single disease, weakening the entire health system. One of the most painful aspects of this history is how rarely affected communities felt heard. Public health efforts often prioritize numerical targets such as coverage rates and eradication milestones. Individual stories of harm or fear were treated as obstacles rather than signals that something needed to change. For families who experienced loss or injury, this lack of acknowledgement felt like abandonment. Trust cannot survive in an environment where people feel invisible. Over time, the breakdown in trust produced real and measurable consequences. In areas where vaccination was resisted, polio continued to circulate. Outbreaks occurred that could have been prevented, leading to more suffering and disability. These outbreaks were sometimes used to justify more forceful interventions, which only reinforced existing fears. It became a cycle in which mistrust fueled disease, and disease fueled mistrust. Gradually, lessons were learned. Global health organizations began to recognize that technical solutions alone were insufficient. Successful campaigns shifted toward community-based approaches that emphasized listening, partnership, and respect. Local health workers, religious leaders, and educators were included in planning and communication. Instead of simply delivering vaccines, programs focused on building relationships. In some regions, these efforts led to significant improvements, demonstrating that trust, once damaged, can be rebuilt with patience and humility. However, the scars remain. The legacy of the polio vaccine continues to influence how people perceive healthcare today. Modern vaccine hesitancy, skepticism toward public health advice, and distrust of medical institutions often trace their roots to historical experiences rather than current evidence. When people express fear, it is rarely because they lack intelligence or compassion. More often, it is because they remember being ignored, misunderstood, or harmed. It is essential to state clearly that the polio vaccine saved millions of lives and remains one of the most effective tools in public health history. Acknowledging its role in damaging trust does not negate its value. Instead, it highlights a crucial truth: medicine operates within social systems, and those systems must be treated with care. Science can tell us what works, but it cannot tell us how people feel. That requires empathy, communication, and respect. The story of the polio vaccine offers vital lessons for the future. As healthcare continues to advance, introducing new vaccines, treatments, and technologies, trust will remain a central challenge. Without it, even the best interventions may fail to reach those who need them most. Public health must move beyond a one-size-fits-all approach and recognize the importance of local context, historical memory, and human experience. Healthcare is not just about preventing disease, it is about building relationships. It requires honesty about risks, accountability when mistakes occur, and genuine engagement with community concerns. Trust cannot be demanded or rushed. It grows slowly through consistent actions and respectful dialogue. In the end, the legacy of the polio vaccine is both a triumph and a warning. It shows what humanity can achieve through science and what can be lost when communication and compassion are overlooked. Remembering this history is not about assigning blame, but about learning how to do better. A healthier future depends not only on medical innovation, but on the trust that allows that innovation to serve everyone. Why this video matters: polio is nearly eradicated, yet mistrust still threatens global health efforts. Knowing the past helps protect the future. Subiascribe. If you care about real medical stories, healthcare truth, and science-based explanations, subscribe to the channel and turn on notifications. New videos every week that explain health without fear or hype. Like, comment, help share. Your support helps spread health awareness that saves lives.